thank you all for being here with us today. Before we get stuck in, I'm just going to invite Leeann to do karakia to whakapai tā mātou tēnei ata. Hei a koe ho.
Me karakia tīmatanga, me mai tātou tuia I runga, tuia I raro, ka rongo te pō, ka rongo te ao, e te kōrero, e te wānanga, puturu o whiti whakamaua kia tēnā.
Tēnā.
Haumie huie,
Tai hie.
Tēnā koe ho. Tēnā koutou katoa, I hui hui mai tēnei ata. E te tuatahi me mihi a te tātou kia koe Leeann mo tēnei karakia o te atanei. Ātāhua tēnā, te ina kupu. I te tuarua, ka haere a tātou.
Aroha, what can you stick up with the kahi?
Oh, pai tēnā, kia ora.
Yeah.
Oh. Is this better?
Yeah.
Project voices, take over. Ai, I te tuarua, ka haere a tātou mihi ki ngā hungamate, haere, haere, haere atu rā ki tō te ārai. E huri ana tā tātou mihi kia koutou katoa ki ngā hunga ora. I hui hui mana I tēnei ata, nei rā te mihi nui kia koutou katoa. Ko ai tēnei, ko Rangi Māori is Sophie Dolly tēnei, no Waaka to Ahau. My name is Rangi Māori. I'm here on behalf of the Action Station team. Just wanting to welcome you all really warmly to our event this morning and thank you all so much for being here to support the Dental for All kaupapa that we know so many of you are really passionately invested in. And just to acknowledge that the work that each of you has brought into this room is really enriching the future of Aotearoa in multiple ways. And so on behalf of our team, we just want to give a really sincere thank you to you all for that work and for the passion that you bring, especially those of you who have travelled from afar. We've got people who have travelled just for this kaupapa. So mihi to you guys from far and wide, including our amazing speakers. But before we hear from them, I am going to do the housekeeping things. Housewarming, housekeeping, yeah. And I just want to acknowledge for a second that normally you would have been hearing from our amazing Jasmine Tankik, who probably most of you are really familiar with. But she's unfortunately sick with the flu, so you get the next most confident Action Station public speaker. And yeah, so thank you all for being here with us today. Housekeeping stuff, bathrooms, if you haven't seen them by now, there are two either side of the elevators. And then if there is an emergency, which most of you who are from Wellington will be prone to hearing this, but drop, cover and hold. And if we need to exit the building, we're going to go down the stairs and across the road on Aurora Terrace towards the car park. Hands up if you understood the instructions, so we're not crying and screaming if anything happens. Beautiful. Awesome. Okay. So without further ado, I'm just going to pass over to Fleur, who is the National Secretary of PSA and is going to talk to us a little bit about this amazing place.
Mahi mai o ha, tēnā koutou, tēnā koutou, tēnā tātou katoa. Can I just say first of all that we're enormously proud to be hosting this event today. It's a very important piece of work that's been produced because I think often in campaigns we have a whole lot of aims, a whole lot of hopes, some really good slogans, some great merch, but actually they sometimes lack the detailed analysis about how we're actually going to achieve what we know is so important. But Dental for All is not like that. There is a very thorough, comprehensive, costed, well thought through approach to how, as a nation, we can deliver Dental for All. And I just want to congratulate the people involved in this coalition because that is a very important part of advancing this kaupapa and it will make a huge difference. You have made this issue credible by the work in this report and the campaign that you've been running all over New Zealand, so thank you so much. We are, as the PSA, the union for public dental workers, and it is absolutely critical that Dental for All is delivered through the public system. It is the privatisation of health and neoliberalism that has delivered the situation we are in today. And I just looked back into the history of dental services in New Zealand in preparation for today. And actually I used to work with a man called Nolo here, who wrote The History of School Dental Nurses. And just a bit of a shout out to that book. It's a really, really good book. But actually, what that book told me is that the New Zealand state set up the state-funded dental service in 1921. It was a world first. And the reason we did it is that when they were assessing the recruits for World War I, 40% of them failed the test because of poor dental hygiene and dental care. And they couldn't meet the threshold needed to represent New Zealand, to go to war, to be a recruit in World War I. And so the response was a world-leading state-funded dental service. I think that's quite an interesting history to reflect on. The other historical moment I just wanted to draw your attention to, and it's because it's my union, but this is a photograph. In 1974, 600 dental nurses went on strike for a pay increase. They hadn't had a pay increase for 21 years. They marched on Parliament. They had beautiful solidarity from meat inspectors, who the government, by the way, is currently attempting to privatise. Meat inspectors said they'd stop the meat plants all over New Zealand unless the government listened to the dental nurses. They got to Parliament, they met with Norman Kirk, and as the PSA historian, who I think is in the room, Grace Miller, reminded me today, the only example of a protest that resolved their issue before they even had to leave Parliament grounds. So the reason I wanted to reflect on those dental nurses and that solidarity and that campaign is to say this is possible. Dental for all is possible. We've had it in New Zealand before. We've had solidarity between meat inspectors and school dental nurses, and this issue resolved when they walked on Parliament grounds before. So this is achievable, this election, and I just am enormously proud of the work of Dental for All and very pleased to host you here. And I really look forward to this being a high-profile issue in the election campaign. Thank you so much.
Kia ora koutou katoa. My name is Kaylee Taylor and I'm a part of the Dental for All team at Action Station. I work a day a week on this campaign, particularly in the research space. And it's my privilege to speak a little bit about this report and where it fits into the campaign. As many of you know, Dental for All is a campaign for free, universal and Te Tiriti Waitangi-consistent oral health care. The campaign was founded in 2022, is hosted by Action Station and is led by a coalition of oral health workers, anti-poverty advocates and unionists, many of whom are in the room today. With funding from the CLEAR Foundation, we've released 3 papers exploring the issue of oral health in Aotearoa. In November 2024, we released a paper on the economics that we're spending billions of dollars every year on the downstream costs of not having dental care be free. This includes an estimated $2.5 billion in lost productivity, $3.1 billion in a reduction of life satisfaction, as well as the costs of things like sick days, inpatient care and cardiovascular disease. A report from 2022 spoke to 10 people across Aotearoa about their experiences of the current system and found that our privatised model for over 18s brings shame, stigma and suffering. And a report from earlier this year surveyed how different countries around the world deliver oral health care and showed us what we already knew. There are alternatives, and our harmful privatised model doesn't need to be this way. We worked on these papers because there's a lack of research about the oral health system in Aotearoa and its consequences for communities. And because we knew that having this research, having that research foundation, would give more confidence to people advocating for change who for so long have known that the system is broken. Last year, the Dental for All team went on a nationwide roadshow, hosting 30 events across 20 towns and cities. We spoke to thousands of people, from Upinoni to Te Aroha, Pūniho to Blackpool and to Invercargill. We heard the same stories over and over again of pain, discomfort and shame. We also heard the same hope, a belief in a better future where everyone can access the oral health care that they need. We knew from these conversations and from the lack of existing research that we need to do our own work to show what that better future could be, what a Dental for All policy would look like in practice. And so this report draws together the threads of that research with interviews from us with 16 experts across oral health, policy and public health, 2 wānanga on the issue of tino rangatiratanga in oral health care, desk research and commissioned costings by independent economists. The report shows that the vision for Dental for All is both feasible and readily deliverable. The report is significant. To our knowledge, it's the first comprehensive costing that includes the public provision of care, specific provisioning of by Māori for Māori services, and funding to support workforce development. The report describes a network of community clinics across Aotearoa. In our costings, there are 701 clinics. 96 of them are mobile to ensure that outreach can occur in even the most hard-to-reach geographic locations, as well as by population splits for urban and provincial clinics. I'm not going to get into the detail of all of that because it's really, really nerdy. There are both 2-chair and 5-chair clinics. These clinics can be beautiful, purpose-built buildings that are safe environments for everybody, perhaps with childcare services at the hub so working parents can access oral health care, knowing that their children are being cared for. A network of well-resourced and well-designed community clinics spread throughout cities, suburbs and towns, as well as mobile vans, mean that everybody in Aotearoa can access regular oral health care in environments and spaces that feel safe to them. The report also provides up-to-date costings on how much it will cost to implement Dental for All. The costings we've done, which include specific funding for services in the Tino Rangatira sphere and workforce development, sit at just $936 million per annum, alongside a one-off capital investment of $1 billion. We've previously cited estimates of between $1 to $2 billion per annum, and these figures sit below that. They also sit well below the current amount that we're spending on the downstream costs of not having Dental for All. The economic argument against this doesn't stack up. It's also worth noting that we aren't in this position with these huge rates of unmet need, unnecessary pain, and the downstream economic costs for any good medical or policy reason. We're here because when the public health system was set up in 1938, dentists lobbied to exclude dentistry from the system. We're in this situation for 88 years with our teeth degrading and our community suffering because of that lobbying. Successive governments have also ignored the issue, letting our oral health decline and with it our quality of life. All of this history, the 88 years of neglect, the research, and the momentum that Dental for All has been building brings us to this moment. It brings us to a report that outlines clearly how Dental for All can be achieved. The simple steps: investing in training, resourcing Māori development and delivery of oral health care, establishing a network of community clinics that must be taken. The report provides costings, specific details on how much it will cost. The report also provides the necessary steps for transition, not so we can eke this out over a generation, but so we can work now to invest in the future of oral health care. The report provides a plan with the steps that we have to take on workforce, service design, and policy capacity to move us closer to being able to deliver Dental for All. Successive governments have ignored oral health care, believing they can keep kicking the can down the road, but we're seeing a movement for change. Communities across Aotearoa, from Upinoni to Invercargill, believe in the vision of Dental for All and believe in their ability to make that change. My hope for this report is that you use it in your advocacy. Help us keep building momentum towards Dental for All. Take it to your local MP, share it with your friends, and keep talking about the future that we're working towards, because it's a future that we all deserve. The report shows us that the change we all want is possible. It's a blueprint for a future government to finally create an oral health system that is free, honours Te Tiriti o Waitangi, and stops the stigma and pain that so many face in their oral health. So let's make it happen. Ngā mihi nui.
Tēnā koutou katoa. Ko waio, he iri ahau no Aotearoa, no Ngāti Whakaihu, no Ngāti Hurunga Te Rangiruki. Ko hamiwa Carrington tōku ingoa. Kora, I'm Sam Carrington. I wear many hats in the oral health space in Aotearoa, but I'm here today as a senior lecturer and the Associate Dean Māori down at Te Kaupeka Pūniho, the Faculty of Dentistry down in Dunedin, where it was frozen cold this morning, so we managed to get here. But firstly, tēnei au ka mihi ki te haukainga o te whanganui ātara, ki a taranaki whanui ki te upuku o te ika, me Ngāti Toa Rangatira, tēnā koutou. It's a privilege to be here today at the launch of this very important report, Fixing Oral Health Care in Aotearoa New Zealand. I want to speak not just as an academic, but as an oral health therapist, someone who sees every day the real consequences of the system this report is trying to change. So we know our current system is failing. We see it in our clinics, we see it in our communities, and this report is very clear that cost is a major barrier, with nearly half of adults avoiding care because they just simply can't afford it. But what I appreciate about this report is that it doesn't just restate the problem, it gives us a plan. And for me, the most important part of that plan is the workforce, which is what I do with my daily job. So you can design the best policy in the world, but it will fail without the right workforce behind it. And what this report does well is recognises that Dental for All is not just a funding reform, it's a workforce transformation. So it calls for an expanded workforce, a salaried public model, and a rebalanced scope of practice, particularly for oral health therapists. I'm a little bit of a policy nerd, so that might come across in this kōrero. And I do need to be very clear here, this system will not succeed if we try to deliver it using the current workforce in the current way. So as an oral health therapist, I see a major opportunity here. The report explicitly recognises that oral health therapists are not just part of the workforce, we are essential to it. So it highlights that us OHTs already deliver prevention within community oral health clinics. We provide the restorative care with additional training on over 18s as well. And we are central to community-based models. But more importantly, it proposes something that we've needed for a long time, removing this artificial divide between child and adult oral health care. So that is a game changer, because right now we have a workforce trained to prevent disease, but structurally limited in where and how we can apply that skill. So in a Dental for All system, that changes. This report talks a lot about expanding dental training places for a Bachelor of Dental Surgery from 60 to 80, which hasn't happened since the 1980s. Funding oral health therapists to upskill in adult restorative care and potentially embedding that training into their undergraduate programs as well. So from where I stand as a senior lecturer, that's critical. But I will add this. This is not just about increasing numbers, it's about redesigning the workforce for the model that we want and the model that we need. A prevention-focused, community-based system requires a very large skill set of clinicians trained in risk-based care, strong grounding in Hauora Māori and Te Tiriti or Waitangi, and the ability to work interdisciplinary whānau-centred models. So that's a different workforce than the one our current system was built for, from 1938. One of the most important recommendations in this report is moving to a salaried workforce, and that matters because it shifts the focus from what will I bill for to what does the person actually need. And from a workforce perspective, it also means there's stability, there's equity in pay, and the ability to work in underserved communities without financial penalty. And that is how you build a system that actually delivers equity for all. So we can't talk about workforce without talking about Te Tiriti, and this report is also very clear that Māori must have authority over design, delivery, and workforce development. And from my perspective, that means growing the Māori oral health workforce, supporting kaupapa Māori providers, and ensuring our graduates are not just clinically competent, but culturally safe. Because workforce is not neutral, it either reproduces inequity or it helps eliminate it. So what does this mean for us right now? It means that we need to start right now, expanding the training pathways, investing in oral health therapists, scope and leadership, strengthening community-based training environments, and aligning education with the system we're trying to build. Because workforce development is not something that happens after policy, it is the foundation of whether this policy succeeds or fails. So I'll finish with this. This report gives us something we haven't had for a long time, and I'll just echo what Fleur said, a credible costed pathway forward. But delivering Dental for All is not just about funding clinics, it's about backing the people who will deliver the care. And from where I stand, if we don't get the workforce right, we don't just fix oral health care, we transform it. Nō reira, tēnā koutou katoa.
Kia ora.
Kia ora koutou. Ko Harriet while tōku ingoa. I am the Policy and Research Director at Toi Mata Haora, ASMS, the Union for Senior Doctors and Dentists. And I want to mihi to my previous speakers who have really laid out the kaupapa why we're here today and why it's critically important that we realise this policy, which is bound to be transformational, should we have the guts to go through with it. So in 2022, Toi Mata Haora published a report called Truth Be Told, the case for universal dental care in Aotearoa, New Zealand. This paper laid out some really confronting facts. 43% of adults had an unmet need for dental care due to cost in the last 12 months. This rose to 54% for Māori and 56% for Pacific peoples. And for children, 10% have had dental extractions due to decay at some point in their lives. When I was preparing for this talk, I checked these stats against the most recent New Zealand Health Survey, and they have not changed in the last decade. If anything, they have crept up, especially when it comes to unmet need. Truth be told, set out an expansive vision for oral health care in Aotearoa that was not solely focused on dental treatment. And I want to call out 3 things from that report that I see in fixing oral health care in Aotearoa New Zealand, the report we're talking about today. Firstly, in 2026, there remains an urgent need to implement public health interventions. And that includes community water fluoridation, a tax on sugary drinks, and taking action on the social determinants of health. It's housing, work, education, and people's access to livable incomes. The community oral health service proposed by Fixing Oral Health Care in Aotearoa is another opportunity to realise these goals and connect with whānau and communities to build change. Secondly, as the Union for Senior Doctors and Dentists, it should come as no surprise that we took a really close look at the oral health workforce in our paper, and it's great to see workforce as a priority in fixing oral health care. This is not just in dentists being salaried as part of the public health system, it is an emphasis on investing in the dental and oral health workforce pipeline. Growing dental school places at the University of Otago from 60 to 80 is a starting point, and expanding oral health therapist numbers and scope will build a solid foundation on which an adult community oral health service can thrive. Once we train them, we want to keep them. Fixing oral health care includes voluntary bonding for our oral health graduates. Terms and conditions for workers in the adult community oral health service should be based on existing terms and conditions for dentists, dental specialists, and oral health therapists employed in the public system. It would also give dentists and other oral health professionals access to paid parental leave, continuing education funding, sick leave, annual leave, and other entitlements that are often not available to contractors in a privatised workforce. We see huge potential for the community oral health service hub model for its ability to build relationships. And our senior doctor members would often share with us how little education they had in medical school about teeth and oral health care. Bringing dentists and oral healthcare workers into greater proximity to other health workers, including GPs, allied health workers, and hospital-based clinicians, can lead to greater collaboration and more multidisciplinary care. Finally, a strong public oral health service needs effective and enabling oversight. This means clinical governance, clinical leadership, quality data, monitoring, and evaluation to ensure what we do makes a difference, especially with equity of access and equity of outcome in mind. And truth be told, Toi Mata Holder called for stronger strategic oversight, monitoring, data, and clinical governance in oral health services. Since 2022, we have seen changes in the scope of oral health expertise at the Ministry of Health, most notably the reduction of the Chief Clinical Advisor Oral Health from a full-time to a part-time position. Clinical oral health governance must be strengthened at the Ministry and at Health New Zealand to ensure that oral health expertise directly informs policy and frontline service delivery, and oral health is prioritised within the public health system. This report has the potential to be transformational, and let's take it back to 1921, where we had something that was doing that. I'm really happy to be here. Thank you so much to Action Station and the Dental for All team for inviting me. Kia ora.
Tēnā rā tātou. Ko te mea tuatahi, tēnā koutou ki te mana whenua, tēnei rohe kia te Aotearoa me Taranaki Whārui. Ko te mea tuarua tēnā koe i te tuahine i tō karakia ho te ata. Ko te mea tuatoru, tēnā koe ki te whare etu nei, tēnā koe ki te pūkenga here tikanga mahi I tō koutou manakitangi I tēnei rā. Tēnā koutou hoki ki a Claire, ki a Te Mārama, ki ngā kaiwhakahaere o te Dental for All Coalition. And kei te mihi nui ki a koutou katoa. Kia ora everyone, my name is Cassie, I'm the Director for Action Station. He uri tēnei no Ngāti Raukawa me Ngāti Tū Whare Toa. And it brings me great joy to be here supporting this event and this policy launch here today. I just want to share a huge mihi to everyone who has been a part of this, and to those who are sharing all of the whakaaro here today. You know, as you say, Fleur, it's sometimes we can have a bright idea, but we haven't necessarily done all the thinking behind to back it up. But I can certainly say that, you know, in our Mahi Action Station, this is probably one of the most thorough campaigns that we've ever done. And really trying to make sure that we include experts and people on the ground from the very beginning rather than as an add-on later on. So yeah, just kei te mihi kia koutou. I next just want to just kind of ground us in the now right now. You know, it's really sitting with me that only a few days ago there was water rushing through many streets of the city. And I really want to acknowledge everyone who has been touched by whether or not it is recent cyclones or recent floods, and whether or not it's you, your loved ones, or your community, because we're all affected by these things, whether it touches our backyard or not. Our team sat together on Tuesday and we took a moment to think about how we were affected and, you know, by what has been happening with our climate. And in particular, I lived in these streets for 13 years and always, I think it's a little bit delusional, but always kind of thought that Wellington would be a fairly safe place. Yeah, we know about the earthquakes, we know about the reclaimed land, we know about the wind, but it was the first time that I'd ever seen water rushing in the way that it was. And I think it was one of those moments that punch you through and make you realise that, you know, nowhere is really safe when it comes to climate events that we can expect now and into the future. And what it means to not just be prepared, but have the basics and the safety nets taken care of every day so that when these things do hit, we're not at breaking point. We're able to move through them and still have good lives. It also made me think about how, you know, we're in this moment where after crises happen, and unfortunately we have many crises going on at any given time right now, whether or not it's here or whether or not it's in a distant place. It's very easy for us to put our head down and to lower our expectations of what is possible. You know, we move into recovery mode. Recovery is just trying to get back to what we had before. It's not looking forward to something better or bigger or brighter. It's just holding down what we currently have and trying to restore that. And this works really well for our country's leaders a lot of the time because it works to have a population who is bound by very low recovery style expectations of what we can have as a country. And I think that it's really important that even when we face crises, we must still absolutely create the space to imagine and have higher expectations of what we can have as a country that looks after us, to move from not just recovery to building the kind of country that is resilient and futuristic and capable of looking after us all. And I think underlying a lot of the kōrero here today, you know, is that we're talking here about oral health, but I think everyone here knows in this room that our health system generally is in a place of great risk. You know, we've already had, you know, we've already been told that what's likely on the horizon is to do what has been done to dental to our entire health system. You know, thinking about the privatisation of the slow privatisation that is happening right now as a way to be able to do that everywhere. I'm thinking about the elective surgeries in public hospitals that have been shifted to private hospitals and going into 10-year contracts to just start the slow easing of doing what has been done here to everything. And if we continue down that world, right, we know where it leads. We know it's this user-pay system of the people who get to have good lives and good health are the people where it depends on their postcode, where they live or what's in their bank account. And we know that everybody else is subjected to having to deal with the absolute horrors often of not being able to access the healthcare that they need for their family to flourish. You know, it's one of those things where you can see the future very well unfolding of having this overburdened households just taking on the weight of every single cost in this constantly increasing you know, cost of living situation, while we watch some people going and laughing all the way to the bank, and it's not good for our teeth, and it's not good for our health, and it's not good for us either. So when I think about that, I think about it's actually possible to be able to have high expectations of our whole health service, of our lives, of our oral health. But sometimes it's very hard, I think, to see that because we can kind of wrap ourselves up in a little like safety blanket of familiarity. And the familiarity is cynicism, the familiarity is low expectations, the familiarity is checking out, getting sucked into the algorithm because it's easier to do that than it is to really fight for what we know that we need. And I get in that safety blanket too. I'm like, oh man, it's so comfy down here. Like, you know, the future is already set, and who are we to do anything different? But often when I think about people who defy low expectations, I often think about Maui Pōtiki, Maui Tiki Tiki, you know, often referred to the demigod of the Pacific. The stories that are shared about Maui, if you've heard of any of them, and I'm sure some of you have, you know, this was a person who refused to accept the world as it currently stands. Whether or not it was catching the sun, whether or not it was pulling up an island, whether or not it was stealing fire, or trying to reverse death. And let us remember that it was a Waitangi who put that to a stop. We know who's in charge here. But you know, in every single instance, we have these stories of a figure, this demigod, who refused to believe that this is how it ends. This is all we can expect. And I just don't believe that Maui would have looked at the world right now and believed that there is not enough money to go around, that there's not enough resource. I think he would have believed that we live in a land of abundance, and it's always been a land of abundance. It's always looked after us. This tile has always looked after us. I think he would have looked around and not believed that some people can make oodles and oodles of money off people's poor health, or that some people deserve more of a right to life than others. I don't think he would believe that. I think he would have done something pretty cheeky to do that. So what I often think of is when I'm getting stuck in that rut, I'm like, oh man, what will it take to lift our expectations? What will it take to bend the will of physics? What will it take to change the very rules that we've been told are true? And yeah, sometimes it takes a bit of tenacity. And he was a little bit arrogant. He was definitely very cheeky. But I think we probably need a little bit of that. We need a little bit of a reverence. We need a little bit of refusing to believe that the rules that we've been taught day in, day out are the way that the world works. Because we know that the world can change in a blink. We've seen that more than enough over the past few years. The world can change in a blink, and it's up to us to be the ones who can change it for the better. So what I ask here today is that as you're sitting here listening to all this beautiful research, the beautiful numbers, all of the thought and care that has really, really considered what it means to make this a reality, to also think about, crawl out from under that safety blanket and think about what it takes to lift our expectations of what we believe is possible. Because, I don't know, I just feel like having our teeth looked after is like pretty chill, like a pretty chill thing to ask for in the grand scheme of things, you know? Like, I'd love to solve world peace tomorrow and like, yeah, let's do that too. But I just think, man, let's start with some teeth, first of all. We can do that. That's all here in the numbers. And in order to do that, you know, I'm guessing that everybody here in the room is fairly already believing in high expectations of what we can achieve together. But it can't end in this room. I think our task next is to make this a popular ask, to make this real, to lift others' expectations with us, to open up the blanket and bring people out and say, look, your cynicism will not serve you. It most certainly will not save you. The only thing that we can really do is to work together to make things like this real, possible, plausible, and actually see it flourish in real life. So, Lord, please share this report, share it with others, remind others that we can make the rules, we can change the rules, we can bend the rules, because it's about all of us having what we need to be able to thrive. Lord, tēnā rā tātou katoa.
Tēnā tātou katoa ko Leeann Waaka kukuingoa, he uri a hau no hokianga, wairarapa. Ka nui te mihi, ka nui te mihi, ka nui te mihi. It's an honour for me to be here today before you, first and foremost as a mokopuna of Lance Corporal, Watchman Waaka of the 28 Māori Battalion, Regimental number 817724, D Company, Ngāti Walkabout, serving alongside his comrades for God, for King, and for country. Kei maumahara tātou ki a rātou. We will remember them. It is an honour to be before you today as Co-Tumuaki of Te Mārama, Aotearoa Māori Dental Association, an association founded upon the aroha and service of our people, our visionaries and influential leaders for their people, Emeritus Professor John Broughton, Whakaihu, Pihopa and Inez Kingi, Ngāti Whakaihu, these courageous leaders who dared to dream, built the foundations in which we as the aspiring and experienced Māori oral health workforce stand firmly upon today. The foundations which you will see embedded within and throughout this policy. Their moimoia or their dream to walk as a collective to achieve he oranga niho mo te iwi Māori. Good oral health for Māori for life. This journey began in 1995 as a call to the Māori oral health workforce to come together to share lived experiences of whānau they serve, as well as to strategise and to implement a plan to action so they too could serve better. This brought together representation across the entire oral health workforce, which makes up our membership. Kuia, kaumātua, clinicians, educators, oral health promoters, specialists, tauira, students, and tangata tiriti, all committed to uplifting and advocating our kaupapa and oranga niho mo te iwi Māori. The first action plan was to establish an association to support existing Māori oral health workforce and build the Māori oral health workforce to better serve our people. This was achieved in 1996, where our inaugural AGM officially registered our association, which was gifted our name, Te Mārama, where truth is brought into the light for balance and understanding to pave the way to action. Born of their action and service was the first Māori oral health provider, Tipuora, Ngāti Whakaihu Rotorua, where the model of care included in this policy document is whānau-led, whānau-driven, whānau-measured, open to all. The community-based oral health clinic was included with the existing Hauora service or Māori health service, with a dentist and a dental therapist serving the entire whānau, more widely recognised these days as whānauora. This included Crown willingness to support and resource whānau aspirations. Te Tiriti in action. As our 28 Māori Battalion soldiers stood side by side on the front line for their people, to be recognised as citizens within their own country, our responsibility now is not simply to remember their sacrifice, but to respond to it. This opportunity for Te Mārama to stand alongside Action Station, Dental for All team, and our coalition comrades in support of this campaign has been of service to our people. And Te Tiriti o Waitangi in action. Standing together as a collective with shared purpose while upholding our foundations, bringing forth our Māori voice, Māori leadership and Māori authority in shaping the future of oral health care in Aotearoa. The Dental for All policy sets out that oral health care must honour and uphold Te Tiriti o Waitangi and must be designed in a way that gives real effect to tino rangatiratanga. Building an oral health system that is not only made for our people, but is shaped with our people, led with our people, and trusted by our people. A Te Tiriti consistent oral health care system means to stand side by side one another, not in sameness, but in true partnership. Heart to heart, aroha, aroha, aroha. Our whānau are the faces behind these statistics that we talk about, and that is why we cannot accept the system as it is. They've suffered long enough. Our whānau deserve an oral health system that is worthy of them, one that upholds their dignity, gives life to Te Tiriti o Waitangi, and brings hei oranga niho mo te iwi Māori to life, into this reality. Dental for All is about restoring dignity as much as it is about delivering care which really does serve our whānau. This policy is carried by the voice of our whānau, as you've heard, and by the solutions they seek. Our hope is that their voices rise beyond this launch today and become the turning point for bold and lasting action. Our people are not asking for more, they are asking for what should have always been. Health inequity is not an accident. It's a result of a decision. And decisions can be changed. So to our political leaders, the question is not what our brave and courageous leaders did for us. The question is what will we do because of them. We will continue to ask Māori to fit within systems not designed by us? Or will we choose to build an oral health system that is free, universal, and Te Tiriti consistent? We carry more than their memory. We carry their expectation. And that expectation is not silence. It is action. It is partnership. It is tino rangatiratanga in every way. They gave everything for our future. We are the generation responsible for what that future looks like. The policy document is purposeful step into that future, which they all could see so very clearly. This is building on our courageous leaders, visionaries, very foundations, so that they meticulously built brick by brick, set solid for all of us to stand on these foundations together as one. Ke maumahara tua tātou ki a rātou. We will remember them. Kia ora.
Sorry, just me doing my dance again. Just use that mic. Tēnā koutou katoa. I muri tēnā, anei taku mihi whakamatinga kia koutou katoa ngā kākōrero o tēnei paipai. I just wanted to take a minute to acknowledge all of the generosity of our speakers today who have come in and shared their expertise and given a lot of their careful consideration to the kaupapa in wake of the report, how meaningful it is to have the support of all these different organisations and all the work that you put into making this kind of more of a reality than it possibly ever has been. And I just also want to acknowledge how grateful I am to have heard about like the history of this work and the necessity of it, and also alongside what Kaylee's been talking about with the research. And Kaylee is not lying when she says she's a research nerd. We hear about it all the time. So very proud of Kaylee and the whole dental team, Max and Hannah and Jasmine, for their work. And Sam, I really appreciated what you were saying about the workplace transformation and how fittingly that was with Harriet, talking about how much guts transformation actually takes. And I think that's a really key message for us, especially hearing a little bit more about what Cassie was saying about, you know, making this a really important ask and a tangible ask, and actually being brave enough to imagine a different future than the one we have right now. And e te mutunga, kia koe Leeann, ngā mihi, thank you for bringing your tupuna into the room and the aspirations of all of our tupuna for a better world. I think that was really beautiful, and I'm just so grateful that you were able to do that and plant the vision of Te Tiriti and the beholding of it in this mihi, so thank you. Before we finish up, I'm going to invite Cassie to do our closing karakia, and then once we've done that, we'd like to invite you all to come out and have kai, talk to each other, connect with each other, share your thoughts, share your opinions, and please do take the report, have a read of it, enjoy it, and like many people have said before, share it as far and wide as you can. Kia koe.
Kia ora anō. Kei te mihi nunui ki a koutou katoa. Thank you for being here. If you haven't already been solicited to be on the Dental for All campaign sign-up list, there is a form at the back desk. If you'd like to be more involved, please do sign up and get more involved. I'm assuming that some of you are already in the tent, but we're always looking for more people, and it will take all of us. And just wanting to acknowledge as well, you know, when you were speaking there, and it really felt like our tupuna were in the room with us. And I think that it's really important for us to know that every single one of us, no matter where we come from and who we are, we come from people who I think wanted us to live really good lives and wanted our children and our mokopuna to live really good lives. And this is a part of it. And I think they would be looking down on us and thinking, okay, what are you doing now? Because there's some stuff that needs to be sorted out. Haere tonu, get to it. So in that spirit, I'm just going to close us up with a karakia, and then we might just finish with a waiata, puri nei. So please do stand after I've done my karakia. And Leeann talked about lifting up our voices so that our whakaaro and our dreams might be heard. And so I think in that spirit, for those of you who can and are willing, please do lift up those voices, because when we hear each other, then it reminds us that we're not alone in asking for high expectations in a better world. We're in this together. So, nō reira, kei te mihi ki a koutou, ka kia tātou. Unuhia ki te uru tapunui, kia wātia, kia mama, te ngākau te tinana, te warua te ara takatu. Koe ara e rongo whakiria ki ki roa. Tuturu whakamaua ki a tina.
Tina.
Haumi e hui e.
Tai ki e.
E te whānau, e te.
E te hau. Horoia. Horoia. E te ua. Whiti, whitia. E te rā. Mahea ke nā. O raru raru. Makere ana nā hewe.
We can go louder, folks.
Erere, wairua erere. Ki ngā o te rangi. Whiti, whitia. E te rā. Mahea ke nā. O raru raru.
kai, e hononga, e te kōrero. Kia ora everyone, thank you.